morning. My name is Muhammad Jamjum Sari, a second-year medicine student of Southwestern University. Would you please state your name and your birthday, please, for me?
My name is Muhammad Ali G. Sharif. My birthday is September 28, 2006.
Alright, so for today, physical examination that we'll be doing would involve your nervous system or neuromuscular system. So I will be assessing some parts of your body with nervous involvement. So would that be okay with you?
Yes.
Alright, so thank you very much. And then, do you have any questions? None at all. So having my hand washed, we will now be starting. Okay? So first is for your cranial nerves. So for your cranial nerves, actually we have a lot of cranial nerves. So one of which is the cranial nerve number 1. That is the olfactory. For the olfactory, I will be asking you to please close your eyes, and then I will be letting you smell this scented objects. Then please say what is it? What is it? So please occlude one nostril first. Good. Okay. Now please smell this. What is this? Vicks. Vicks. Very good. How about this one? Perfume or cologne. And then that applies to the other side. Okay, open your eyes now. So that applies to the other. Now, for the cranial nerve number 2, that is for olfactory and it says that your cranial nerve number 1 is intact. Now, let's proceed to your cranial nerve number 2. And that is for your visual acuity. Now, for your visual acuity, I'm going to test your eyes, both of them, the acuity or your ability to look into a 20/20 visual. So in a 6 feet distance, I would ask you to please close your other eye, your non-test eye. So this is your test eye. So please read the letters LIFPH. Okay, to the other eye. LTFPH. Okay, very good. So it only says that the cranial nerve number 2 visual acuity is intact. So for your cranial nerve number 2 and 3, that would be your pupil. Now in pupil, I will be assessing for its size and its shape. So with the use of a pen light, so please look ahead, look straight, and then okay. The other eye. Okay, so ideally and in present, in your case, your pupil are equally round, so that's very normal. And then in terms of shape, and then the size is 3 centimeter, so that's very normal since our normal is 3 to 5 centimeter. At some references at 2 centimeter. Now, moving on is for the cranial nerve number 3, 4, and 6. So that would involve your abducens or the cardinal gases. So for the cardinal gases, would you please look at the tip of this pen light and then follow it with your eyes, not with your head. Okay? Up. Okay. Down. That. And then the other. Up. And then downward. And then proceeding, test for convergence. Okay, so very good. So it only says that your cranial nerve number 3, 4, and 5, the cardinal gaze, nerve are intact. Now to proceed for still in relation to your eyes, is the cranial nerve number 5, and that is the corneal reflex. So for the corneal reflex, would you please look straight ahead, and then approaching at the lateral, I will try to test for you. Okay, so your cranial number 5, the corneal reflex is intact. Now let's proceed now to your cranial nerve number 7 or your facial nerves. For your facial nerves, could you please raise your eyebrows for me, please? Raise, and then frown for me, frown, and then puff your cheeks. puff your cheeks, and then smile. Smile for them. Alright, very good. Now for the cranial nerve number 8, that will be involving the hearing. So to detect hearing loss, so I would be asking you to please sit here. Okay, sit here behind me, and I will be behind you, and then at one meter away, or an arm length, I will ask you to please include your non-test ear, and then with your testing ear, please press the tragus. Now I will please repeat the words or the numbers I will have to say, the letters or the numbers I will be speaking. Alright?
Yes.
Alright, so deep breath as the examiner.
F or J.
Okay, very good. So supposedly on the other side again. So at this point, it is your cranial nerve number 8 is normal. So please sit back to your chair again. Now, after assessing for your whispered voice test, I will now be assessing also for the gag reflex with the use of a tongue depressor. And then what I'm trying to identify here is the cranial nerve number 9 and 10. They are intact. Okay? So could you please open your mouth? Then I will have to insert supposedly a tongue depressor, and then reach for the vestibule, and then ask for the patient to not resist the gag reflex. Okay, so that's it. So it only says that the cranial nerve number 9 and number 10 are intact, the gag reflex. Now, since we have already involved the tongue or the mouth, let's now proceed finally with the cranial nerve number 11. So that will include your tongue. So please open your mouth, stick out your tongue for me, upward, downward, side, and then the other side. Alright, so very good. Close your mouth. Now, we will now be proceeding to the grip, to the muscle strength. So for the muscle strength, normally it is 5 in grade. So that would indicate that the patient is able, and then no evidences of weakness, and then no evidences of paralysis at worst. So for the first one is the grip strength. For the grip strength, I would be handing over the patient my middle and then the index finger for him to grip. Then with my other hand, asking the patient to pull. So in this case, it is very much evidently strong, so that is normal. Now for the opposition of thumbs, to the other hand, the opposition of thumbs would include the patient's thumb and then the smallest finger. And then for me, as the examiner, I will be touching my thumb also corresponding to the patient's thumb. So in this manner, and then I will have to ask the patient to reach for his smallest finger. So please. Okay. So in this test, the grade is 5, and that is very normal. No signs of any weaknesses. And then finally, for the muscle strength, we have the ankle dorsiflexion and then the plantar flexion. So could you please place your feet rather, over this one. Alright, now I will have to ask you to please resist my hand. Okay, so that will indicate 5, so that is very strong. And then for the plantar flexion, please resist my hand, so pulling direction. Okay, very good. So again, another normal, a score of 5. So that is for the muscle strength. Now we proceed now to another test that would include your balance. So this or the cerebellum. So this would include the finger to nose test. So for the finger to nose test, please face me directly, and then I will have to ask you to is very good, very good. And then on the other side, ideally. So another one is for the heel to shin. For the heel to shin, please with your other leg, please place your heel to your knee, down to the shin again. Okay, and then on the other side, supposedly. Now for the rapid alternating movement, so that would include your arm. Please do as I am doing. So, and then up, and then again, and then up, and then repeatedly. It can be done with one arm or the other arm, both arms. So both arms. Okay. So I'm trying to look for any weaknesses, any awkward movements. So this time there's none. So very good. So for the heel to toe, please stand up. Since it is called heel to toe, we touch the heel with the toe, and then vice versa with every other foot. Alright? So would you please again go. Walk, heel, and then toe, and then heel, and then toe. Alright. So please return to your seat. Now we have this test, Bloomberg, and then the Pronator GIF. So Bloomberg test, both of them involves closing of eyes. However, it differs with the manner of the extension of the hands. So for the Bloomberg test, could you please stand up again? Now, stand up, and then for ideally 20 to 30 seconds, let the patient stand with feet together, and then with an open eye. So after 20 to 30 seconds, I will have to ask you to close now your eyes. Close eyes, and then for 20 to 30 seconds, while I am looking at any imbalances with the patient's stature. Alright? So that is for the Bloomberg test. Now for the Pronator GIF, for the Pronator GIF, I will have to ask you to please open your eyes now. Open your eyes, and then please extend your arm, and then your palm out, abduction, and then close your eyes now. So that is for 20 to 30 seconds. So I'm once again looking for any imbalances. So at this point, in this case, there's none. So it is very normal. So, okay, you can sit down. Now let's proceed to the sensory neural, or for your sensations, as well as your discriminatory sensations. First, for the sensations, I will have to ask you to please close your eyes, and then please tell me if this is a sharp or blunt. So I will be assessing for your pain sensation, and then with one dermatome, I've chosen this dermatome. Please tell, is this sharp or blunt? Blunt. Sharp or blunt? Sharp. Sharp or blunt? Sharp. Okay, so I'm using the tip of the reflex hammer as the sharp, and then the tip of the tuning fork as the blunt. So in this case, it's very normal. So again, still closing eyes. Please identify for the temperature. With the other dermatome, here, dermatome, please tell me if this is hot or cold. Cold. Okay, so cold. So that is very normal. Now for the light touch, I will be using a wisp of cotton. Now for a wisp of cotton, I will ask you to locate, to state if you feel it. Do you feel it? Yes. How about this one? Yes. Now I will try to make the patient locate it. Do you feel this one? Yes. Where? Very good. So that's very normal. Now for the proprioception, that will include your big toe. So that will include, okay, you can rest your hands now, but still close eyes. So with your big toe, I will have to indicate your sense of direction. Okay? So please state if upward, downward, leftward, or rightward.
Up,
Very good.
downward, right.
Okay, very good, very good, very good. So that is all for the proprioception. Now, I will have to, still on the sensation, however, this is a discriminatory sensation. So I will have to ask for your hand or palm, and then please state what number or letter is this.
3,
How about this one?
2,
Very good. So that is for the gravitation test. Now to test for the 2-point discrimination, still closed eyes, I will be using, since I don't have paperclip, I will be using a puller. Since there are 2, and then at the back only 1. So 2-point. 2-point or 1-point. Now I will have to ask you if you felt 2-point or 1-point, okay? I will have to make this a discriminatory. 1 or 2?
1,
How about this one?
1,
How about this one?
1,
How about this one?
1,
This one?
2,
Okay. So that is already normal. So I'm using the paperclip instead. I know, the puller instead. Now, for the point of localization, I will have to ask you if it can be the puller or this one. I will be choosing now this one. I will have to ask you to point where the pain you felt was. Okay? 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 Okay, so very good. So your point localization is very much intact. Now I will have to proceed now to your reflexes with the use of a reflex hammer. So with the use of my thumb and then index finger in a brisk swing, I will have this motion done and then tested onto you. Now for the first one, you can now open your eyes. Now for the biceps, I will be starting with your reflexes with your biceps. So your biceps will be here, and then with a brisk swing, I will have to desperate, and then relax. Okay, now that is for the biceps. For the triceps, should be at the back of the elbow, at the ball socket. Then, again. Alright, so for the patellar or the quadriceps in turn, this would involve the knee. Usually below at the socket, suprapatellar, below the suprapatellar or the patellar. So I will now be directly and lifting so that I can see. Okay, so that is for the patellar or the quadriceps. Now for the ankle, it would involve this part, the back part, or the Achilles part. So instead of the pointy one, I would be using the blunt one at the back. So still releasing the patient. Slightly push. Okay. So finally for the abdominal and then the planar. For the abdominal, this will include cotton applicator or any pointy object. So could you please raise your top for me? You need not remove it. And then I will form an X or lines, crossed lines that are proceeding towards the umbilicus, such as this one. Okay. So as what can be seen, there is a contraction, awkward contraction on the abdomen, and that is very, very much normal. So the reflex of the abdomen indicates that it's normal. Okay, cover it now, and And then finally is for the printer. Now for the printer, I would be asking the patient to not resist it as I move a tip of a button applicator. Okay, and then the other. Okay, so there is a flexion of the thumb or the finger toes. So that would indicate a very, very, very normal findings. So that's it for your neuromuscular. After assessing, it would only mean that you are a very healthy 14-year-old child, and that would make your mom very happy. So for now, thank you very much for your participation, and see you again.